Thumb or digit sucking habit, classification and causes. In a lively park, children played happily until a dispute between two older boys disrupted the fun. Nena, a gentle and kind-hearted 6-year-old girl, felt overwhelmed by the conflict and sought comfort on a nearby bench by sucking her thumb and gazing at the distant trees. Nena's mother observed her daughter's distress and thumb-sucking habit from a distance. As the other parents there mentioned that the habit may have dental implications, Nena's mother decided to take the child to the dentist. At the clinic, the dentist examined Nena's teeth and jaw, noting signs of potential misalignment, while also explaining how persistent thumb sucking affects dental development and the need for early intervention to prevent further problems. Thumb sucking in children is a primitive reflex in early childhood, without specific causes, often for comfort and security. Additionally, it is an early sign of coordinated muscular activity in infants, considered a natural process. The sucking reflex is observed to be stimulated as early as the 29th week in utero and disappears between ages 1 to 3.5 years. If it persists beyond the age of 4 years, it could lead to severe issues with teeth and orofacial growth. Based on the conditioning of the nourishment, sucking habits can be divided into two types, namely the nutritive and non-nutritive sucking habits. Nutritive sucking habits involve feeding behaviors like breast or bottle feeding that provides essential nutrients. Breastfeeding supports natural nutritive sucking, aiding in oral muscle development and functions. On the other hand, bottle feeding can cause poor masticatory functions and obstruct normal development. Non-nutritive sucking habits, such as thumb sucking or pacifier use, are comforting behavior developed early in infants to self-soothe. These disrupt orofacial growth and development when practiced for a prolonged time. Let us begin with defining thumb sucking according to Gellin in 1978. It is the placement of the thumb by varying depths in the mouth. Thumb or digit sucking can be categorized as normal and abnormal thumb sucking. Normal thumb sucking is typically considered a common behavior during the initial 1.5 years of a child's life, after which it naturally diminishes. The habit is called abnormal thumb sucking when it persists beyond the preschool period. Thumb sucking can also be categorized based on underlying cause. In the psychological type, the habit may involve deep-rooted causes associated with neglect and loneliness. In habitual thumb sucking, there may not be any psychological factors, but is just a habit. In the year 1973, Sutcliffe classified the thumb sucking habit into types A, B, C, and D, based on the depth of placement of the digit and contact of the jaws. Type A is seen in almost 50% of the children. Here, the whole digit is placed inside the mouth with the pad of the thumb pressing over the palate. At the same time, maxillary and mandibular oral contact is present. Next, we have type B, which is seen in almost 13 to 24% of children. Here, the thumb is just placed into the oral cavity. At the same time, the maxillary and mandibular contact is maintained. Next is type C. This is seen in about 18% of the children. The thumb is placed into the mouth, just beyond the first joint, and contacts the hard palate and the maxillary incisors. But there is no contact with mandibular anterior incisors. Lastly, we have type D, seen in almost 6% of children, where only a small portion of the thumb is placed into the mouth. Now let's explore the reasons behind this habit. These have been explained by different theories, such as the classical Freudian theory or the psychoanalytical theory, non-Freudian concepts, the learning theory, oral drive theory, Johnson and Larson's concept. Let us get into the details of the psychoanalytical theory. This theory explains the behavior in infants. In this baby, thumb sucking is a natural response. It is inherited because, at this age, the oral cavity is the erogenous zone. This infant sucks his thumb to seek pleasure from it, but may also associate it with hunger, satiety, and security. All humans possess a biological sucking drive. Deprivation of this activity could result in an emotionally insecure individual. Next, let's discuss non-Freudian theories. If this infant continues the sucking habit beyond infancy, it can be explained by the non-Freudian theory. It suggests that the persisting habit is due to underlying psychological issues rather than natural developmental processes. Children falling into this category may be seen as having emotional disturbances. It could also indicate a fixation at the oral stage of psychosexual development. Authors supporting this view suggest that unresolved psychological conflicts contribute to the continuation of thumb sucking into later childhood. Next, let us understand how the various learning theories explain this habit. Although this child has learned this habit of sucking his thumb, the theory says it can also be unlearned. For example, this child only sucks her fingers when she holds her favorite blanket. Once the blanket was given away, she stopped the habit. Moving on, let's discuss the Davidson's theory. This theory explains the non-nutritive sucking habits. This baby began sucking her thumb as a response to hunger. Over time, the habit passed on to the most convenient and easily available object, such as the thumb. According to this theory, babies eventually hold on to this habit for pleasure. Next, we have the oral drive theory. Let's take the case of this baby who developed the thumb-sucking habit after a prolonged period of breastfeeding. Although other theories say a child may develop this habit to handle the stress of being weaned off, the oral drive theory says it is actually a result of a prolonged feeding period itself. Lastly, we have the Johnson and Larson's concept. This theory proposes a hybrid approach that integrates elements of psychoanalytical theory and behavioral learning theory to explain the development of the habit, also taking into account the impact of environmental factors. Let's explain this concept with a simple example. This baby started sucking his thumb as a natural habit. As time passed, the child sought oral pleasure from this habit, which can be explained by the psychoanalytical theory. Eventually, environmental factors and pleasure led to this habit becoming more permanent. Now that we know the different theories explaining this habit, let us understand the underlying causes. First on the list is socioeconomic status. In high socioeconomic status families, mothers often have the resources to efficiently feed their babies, satisfying their hunger promptly. Conversely, in low socioeconomic groups, mothers may struggle to provide adequate breast milk, leading to infants to suckle intensely for extended periods to fulfill their feeding needs. Next, we have the case of working mothers. Children of working parents are frequently observed to exhibit thumb-sucking habits, possibly due to being cared for by non-parental caregivers, which can foster feelings of insecurity in the child. The next factor is the number of siblings. More siblings can result in parental attention being divided, leading to the development of suckling habits in the child that feels neglected by their parents. Thumb sucking may help them cope with feelings of insecurity. The next factor is the order of birth. Children born later in the sibling hierarchy are more likely to develop oral habits, possibly due to varying levels of attention and parenting dynamics within the family. The next factor is stress. Thumb-sucking behavior has been associated with emotional or stress-related factors, suggesting a potential link between psychological well-being and the development of this habit. The timing of the onset of thumb-sucking habits can also hold significance. In neonates, it is linked to basic needs of hunger and discomfort. In the first few weeks after birth, it could be a response to feeding difficulties. During the primary teeth eruption, it may serve to alleviate teething discomfort. In later stages, children may resort to thumb sucking as a coping mechanism to alleviate emotional stress that they struggle to manage, seeking comfort in reverting to infantile behavioral patterns as a form of emotional release. Ideally, breaking the habit at 6 to 7 months is recommended as it becomes harder to stop after 4 to 5 years. The habit may begin due to a particular reason, but may persist for different other reasons. This could complicate the process of stopping the habit. Did you know? It has been proposed that genetic factors can influence behavior, and the persistent habit of thumb sucking into adolescence may have a genetic predisposition within families. However, there is ongoing research in this field to further explore it. Some individuals naturally outgrow the habit of thumb sucking, while others may persist with it into adulthood, often in private. The exact reasons for this behavior are not fully understood, but it is believed to serve as a stress-relieving mechanism. Anecdotal evidence even links thumb sucking to conditions like trichotillomania, characterized by the irresistible urge to pull out scalp, eyebrow, or body hair. Additionally, it has been observed in cases of age regression, where individuals exhibit behaviors below their actual age. Pop quiz. This brings us to the end of this video. In the next one, we will continue the diagnosis and management of thumb sucking. We hope you had fun learning with us.